My name is Brian Chong. I'm one of the doctors here at Dr. 360. I'm an occupational medicine as well as the urgent care doctor up here in Auckland, and I have multiple interests in both sports as well as sports medicine as well as head injury assessment and concussion assessment of athletes as well as the general public.
Sweet. So just in the most basic terms, kind of what is a concussion and what are the implications of that for someone's short-term and long-term health?
Yeah. So a concussion is another way of another name for what we call a mild traumatic brain injury. It's a form of traumatic brain injury that one sustains after an accident involving an impact of some sort, and it's most commonly seen in New Zealand in the form of sports injuries and car accidents as well. Although we have seen increases in concussion-related injuries from use of e-scooters as well as other motorized modalities. Concussion is quite relatively poorly understood, and it's something that has the potential for quite significant both short as well as long-term effects for patient health and patient outcomes as well as overall well-being and quality of life. What we've seen in general is that poorly treated and poorly identified head injury and concussion has the potential to exacerbate and make illnesses due to repeated injury and insult from not resting and not allowing the body to heal. And we see that a lot with combat sports injuries where athletes are subjected to repeated injury and repeated trauma to the head without adequate rest and rehabilitation following a concussion. And that's something that we're trying to both educate as well as make more aware that that's something that needs to be identified early and treated appropriately.
Sweet. So what currently is being done to kind of mitigate these risks within the combat kind of sport?
Yeah, traditionally, typically, combat sports, both contact as well as combat sports, but particularly combat sports, have historically had quite poor track records of looking after athletes and adequately providing screening as well as identification and treatment of injuries, especially head injuries and concussion-related injuries. What we've seen in modern day professional sports is new tighter regulations in place. However, we have identified that there's still a lot of room for improvement and still a lot of room for modifications of our processes to ensure that athletes are both looked after before and during participation in their code of sports.
So the current state of regulation making improvements, but still a long way.
Yeah. There is definitely a long way to go. There are improvements. Many combat sports and codes now are incorporating the use of health professionals ringside, health professionals fieldside, in order to identify speedy as well as accurate diagnosis of any injuries that might take place. But with that being said, a lot of sports codes, very sorry about that, a lot of sports codes are still catching up to the regulations, and what we find is that there's a lot of neglect at the lower grassroots levels of sporting, the weekend sports and the college level sports that really could benefit from quite a lot of improvements in the way they screen and identify and keep their athletes safe.
So when things like CTE, which are a little bit more of a, over a prolonged period of time, but not as heavy impacts, particularly in combat sports, things like headgear and stuff, does that really do much?
Yeah, definitely. Headgear and protective equipment of any kind, especially those that have been tried and tested, do provide some degree of protection, and it's something that more codes should adopt. The problem with headgear we generally find is incorrect use as well as inadequate supply of protective equipment occasionally do come up as issues that we find preventing the protection of athletes, especially in some codes that have less tighter regulations around the use of protective equipment. It's definitely seen a reduction in overall numbers of patterns of injury and burden of injury that's caused by these high impact trauma and high impact knocks to various parts of the body. But with that being said, there's only so much that can be protected whilst engaging in a sport that's designed for physical impact. And whilst risk mitigation is absolute of utmost priority, there is some unavoidable risks that's involved with sports at these levels and for all levels for that matter. And that's why beyond protective equipment, health screening, adequate health education, as well as adequate follow-up in health clinics is of utmost importance for maintaining the health and the well-being of these athletes.
I saw a thing came out a couple of days ago where they're now proposing a kind of a framework to diagnose CTE in living patients, because that was previously not really done. Do you kind of see a future where that can significantly affect how certain sports are kind of, played? And is there a way to kind of, as you were saying, still have the sport be the sport?
Yeah, you hit on a really good point. It is a fine balance on, constantly improving the sport and making sure the athletes are safe, but whilst keeping what the essence of the sport is and keeping the overall meaning of the sport without compromising the integrity of it too much. And I completely agree. There is leading edge technology coming through that really provides point of care diagnosis without impeding too much on the code itself and impeding too much on the ability for the sport to be played the way it's meant to be played. I think that there is definitely a good scope for improvement of these with the technology coming through for CTE detection, early CTE detection as well as management. As with any medically or health related field, things need to be tested quite thoroughly and make sure to ensure that there is a robust method to the efficacy that we are constantly able to replicate good results all the way through. But yeah, I completely agree that there is a huge change that's slowly happening with the detection of CTE and the management of CTE in contact and combat sports. And I personally would like to see that driven through sooner rather than later, as a matter of priority, just because every moment wasted is added risk to these athletes, and it has very real and long-term consequences to their health and well-being.
Yeah. On the treatment side, I've seen that some stuff has been kind of coming out, studies around the use of psilocybin to kind of help the brain. I don't know too much about it, but I'd like your perspective on that.
Yeah. As I mentioned earlier, management of brain injuries, and I mean more about the mild to moderate spectrum, not talking about the traumatic brain bleeds or anything like that. Management of mild to moderate brain injury or concussion, for that matter, it's quite relatively poorly understood compared to some of the other medical problems and injuries we deal with. We find that there is lack of evidence-based research in the literature to guide best practice principles. There is definitely new technologies both in the diagnostic as well as the treatment realm that we are looking at. To name a few, there are new research into medications that can help manage and reduce the ongoing symptoms of acute brain injury as well as mild traumatic brain injury with long-term effects going forward. There is always further scope for more research and development in these in the different therapeutic options that are coming online to be available. But one of the most important things to note, and this is something that I tell everyone, is that prevention is always better than cure. And whilst it sounds cliche, it really does ring true for things like mild traumatic brain injury or concussion, because following a head injury, the brain may not be able to return to its pre-injury state, and that's something that we find that can actually happen more often than not. No matter how much therapies and rehabilitation we do, there is a scope where if the brain is significantly injured enough, it's not going to return to its pre-baseline condition, and that's where appropriate health screening, appropriate surveillance, and appropriate preventative medicine is actually one of the best things we can see going forward.
I suppose in the context of a sport where the essence is trauma, falling back on those treatments is still
Yeah,
a route to the future, I guess.
yeah, absolutely. I mean, it's quite, I guess, it's a bit ironic to say that we're talking about preventative medicine in a sport where the whole goal is to inflict trauma to the head and to various parts of the body. But with that being said, it can be done in a safe manner. And yes, there is always an argument that there is a risk of stripping the essence of the sport and the rawness and the way it used to be kind of thing. But I think that slowly there is a bit of a paradigm shift where we're starting to realize that the way it used to be is not the way it should be.
Yeah.
And there is a lot of scope to actually look after these fighters and look after these athletes while still providing, a good platform for them to practice their code and for spectators to enjoy the sport in general.
Yeah, I think another interesting angle, particularly in New Zealand, is the rugby kind of culture. Again, from a young age, even I was brought up playing rugby. Do you see there being a potential kind of risk, obviously, there, and kind of what, is that parallel to kind of what's coming out about boxing and
Yeah.
MMA and the NFL, right?
Yeah. Look, with rugby and rugby league, it's fair to say that it's probably in the essence of the New Zealand DNA, and to whilst not perhaps in the same extent as in the combat sports arena, certainly you have players running towards each other at high speeds, high velocities, and they sustain head knocks day in, day out. The problem with rugby is both organizational, but it's also a bit of a culture thing. There is a lot of, I guess, grassroots enable, flow streams to support the professional sport. And whilst top level rugby players get, some of the best care out there available and health surveillance, we have to remember that what feeds the professional sport in the top class level is the grassroots and is the college level rugby, is the schoolboy rugby, it's the college competitions that we have, and a lot of them unfortunately don't have a lot of adequate health surveillance, and we have young fit New Zealanders and athletes getting injured day in, day out on the rugby fields and sports fields, but not receiving the appropriate follow-up care. And while some of them may be lucky enough to not have any long-term effects, on the other hand, some of them aren't, and the effects of them, of these injuries that go undiagnosed and untreated, can last for years, if not the entire life. And it's something that I feel that we need to put more attention into, and there's a lot of scope for doing that. And I think whilst combat sports, it's a bit more blatant, it's a bit more obvious. That is the mode of the sport, it's to do with constant impact and high, we can't rule out contact sports, where rugby players are running full speed each other with no headgear whatsoever, and they're sustaining these knocks day in, day out on the training field, on the sports field, So it's one of those things. I think there is a lot of scope for improvement that's available.
Kind of in a perfect world, if you could kind of change the kind of structure of these things, what could be changed now that would significantly impact the kind of future?
Yeah, as I mentioned, I'm going to harp on about it again. Prevention is better than cure, and whilst we can throw our resources into treating head injury, which I think obviously there needs to be something done about developing appropriate resources to enable people with pre-existing or existing head injury to get treatment. I think given a limited resource capability, we should really put a lot of focus on prevention and primary prevention of these injuries, and that stems a lot from appropriate screening and surveillance of athletes to make sure that they're not going onto the sports field with pre-existing injuries or have completely recovered from a concussion that they suffered a month back, and not exposing them to this repeated insults to injury, which really has a cumulative effect on these athletes. In an ideal world, every athlete, regardless of what level they're playing at and what their code is, if there's a risk for injury from high impact, then there should be appropriate health surveillance, and there shouldn't be any restriction to any access for appropriate concussion, early concussion screening and head injury screening for these athletes.
Kind of conscious of your time. Thank you for everything.
Absolute pleasure.
Appreciate it.
No problem. You're welcome.
Thank
Yeah.
you.